So this is metabolic syndrome. So we call it metabolic syndrome. It used to be called syndrome X. It would be the bit before diabetes is sort of pre-diabetic, but you don't have to go into diabetes, as we've just shown. It can be a whole load of other things. So like I was saying, those people who are in, very, very lean, but then suddenly having heart attacks, it's metabolic syndrome. So one of the parts of metabolic syndrome, and the most common, is this being overweight or having too much fat around your waist. If I'm honest, I actually think that you're lucky if that's the bit you're getting, because it's obvious. It's super obvious that your body is under inflammation and you need to do something about it. It's actually the people where there is this incredible leanness to them. My partner has a friend who likes to eat a lot of biscuits and what have you, and my partner was like, do you not worry about the amount of sugar? Well, I don't get fat. I'm not fat. And it's like, well, there's so much else that could be going on here. Like, we have to be aware of this. So like I say, I always see it as a blessing. Laura and I have, I think it's just because we've had to deal with our health in this way, going, oh, another patch of psoriasis. Great. Thanks for the message, body. Oh, hormone fallout. Thanks for the message, body. Great. I'm muffin topping. Thanks for the message. So, but it kind of is, because it's almost like the weight can happen super fast, whereas a heart attack could take years. So that's actually where I go, great. Now we know what we're dealing with. High triglyceride levels in the blood. And again, it doesn't matter about weight, people have these. Low levels of HDL, which is considered the good cholesterol, but actually all cholesterol is good. It's just misunderstood. So don't like to be in a binary place, and we want to validate all the cholesterol. But the HDL is actually more about mopping up. But it's interesting. So if we've got lower levels of HDL and higher levels of LDL, what that actually means is the body is trying to mop up inflammation. Isn't that interesting? It's just that we go, if you've got loads of HDL, then you're all right. Well, yeah, you just need to not have too much LDL. High blood pressure that's consistently 140/90 or higher. Do you know what, though? They've now changed that. Well, yeah, that's changed. I trained as a lifeguard, and historically, blood pressure, I literally was stunned. I was actually sat in a GP surgery a little while back waiting for a blood test, and I saw about blood pressure being 140/90. And I thought, when did that change? Because I didn't get the memo, because it was always 120/80. But this is what happens with the medical model, where I go, hang on a minute, science, you'll just keep changing the parameters, because now so many people are in metabolic syndrome, they've actually had to increase the parameters of what's normal. So yes, it's now high blood pressure that's consistently over 140/90. Historically, it was 120/80. So this is how we normalize things bit by bit by bit. An inability to control our blood sugar levels. So that's about having the high glucose in the blood. And we would say that even that's actually very specific. Well, you've got to know what your blood sugars are. Actually, there are a myriad of signs and symptoms before you even get to this place. It's anxiety, it's the not being able to sleep, it's the give me some more, they're always hungry, it's weight issues, often needing to go to the loo all the time. There are so many signs that we are in a place of not being able to control our blood sugars before we get to metabolic syndrome. This stuff does not come out of the blue. It takes years to build into this.
Hangry is a great one. People not being hungry.
Yes, or not hungry at all. So really messed up food signaling. 25 to 33% of adults have metabolic syndrome. Shocking, absolutely shocking. And 88%, according to Dr. Ben Bickman, are metabolically unwell. So that could just be one of those or two of those. 88% of us are metabolically unwell. And the kicker is, you do it to yourself. Like, we do it to ourselves. This is absolutely an adaptation because we have forgotten to live the way that we are supposed to live. That's the bit that's heartbreaking.